Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update with data accurate through December 16th, 2021. This week, I'm going to follow up on last week's question, which is what is happening with the current surge in cases and deaths. And I'm also going to talk about a question that came in this week. What should we know about breakthrough infections? In terms of the surge, you can see globally that we've seen this undulating pattern of cases, and it seems to be almost as high now as it has been at any time. We're not quite seeing the same pattern with deaths where it's leveling off, but it's important to point out that it's actually leveling off at a rate that's higher than at any time except during the three previous peaks. Over 5 million deaths worldwide and about 7,000 deaths a day. In terms of the United States, you see the same pattern with the increase in cases, but sort of a leveling off of deaths. But again, nothing to be particularly excited about because with over 800,000 deaths and over 1,200 deaths per day, this is still a serious issue for us. And if you look at hospitalizations, again, the numbers are creeping back up. They're nowhere close to where they were during the two previous peaks, but we don't know where this is going to go. And that's always a harbinger of potential increases in deaths in the coming weeks. In terms of Tennessee, we're not seeing quite the same number increase in cases or in deaths. Tennessee's had almost 18,000 deaths today, running somewhere between 50 and 100 deaths a day. But you can see this, it's kind of a scattered number. And with hospitalizations, again, creeping up, but again, nowhere close to where it was. And this is probably because right now, most of the cases are happening in the north and the northeast, but that doesn't mean it's not going to happen here. In terms of Allied Health, 245 hospitalizations right now. Again, that's about this. It's higher than it's been any time except the two previous peaks. So again, we just have to keep an eye on it. Of the 245 hospitalized patients, 222, or about 91%, are not vaccinated. Of the 71 patients in the ICU, 68 96% roughly, and about 96% of intubated patients. So what this tells you, again, as we've said many, many times, is vaccines protect against serious illness and death, but they're not completely effective. And that's what we need to talk about next, which is breakthrough infections. What is a breakthrough infection? Well, it's an infection that occurs in someone who is fully vaccinated, right? And according to the CDC, in mid-October, there had been 7,000 breakthrough deaths nationwide. And according to data from the Tennessee Department of Health, just last week, there had been 793 breakthrough deaths in Tennessee. Many people look at this and go, oh my gosh, this means the vaccines are not working. And that's not the case. So let me give you an analogy that may not be the best one to use, but let's take helmets and body armor, right? If someone wears helmets and body armor, they're protecting two of the most vulnerable parts of their body. It doesn't protect them. It doesn't reduce the number of bullets that are being shot, but it reduces the chance of it hitting the chest or the top of the head, two of the most vulnerable parts of the body. But even someone wearing body armor and a helmet can be hit in the arm or leg, and unfortunately can also be hit in the lower part of the skull. So what does all that mean? Well, body armor and helmets clearly reduce serious illness and death, but they don't eliminate them. And nobody's going to suggest that our SWAT teams and sheriffs and others shouldn't wear body armor or helmets when they're going into a risky situation. And the same is true with vaccines. They don't completely eliminate the risk of disease or death, but they greatly reduce them. They are a protective mechanism. So according to the Centers for Disease Control, an unvaccinated person is almost 6 times more likely to test positive for COVID. But this next number is really more important. An unvaccinated person is about 14 times more likely to die from COVID-19 than a fully vaccinated person, 14 times. Again, the vaccines are not perfect. There will be breakthrough deaths, but overwhelming data to suggest that they protect against serious illness and death. And you can see it here. The black line is cases in unvaccinated, and the blue line is cases. I mean, in deaths, not cases, in vaccinated folks. And you can see there was an increase during the most recent peak. There was an increase in fully vaccinated deaths, the death rate among fully vaccinated people, but it's much, much less than the death rate in unvaccinated people. And a question came in this week about the differences between different vaccines. So here you've got the J&J vaccine in orange, Pfizer in blue, Moderna in green, really not a lot of difference between them. So if you take the 793 deaths in Tennessee, that does look like a lot, but let me explain it this way. That came from almost 3.5 million people in the state who've been fully vaccinated. That represents a death rate of about 0.023%, or about 1/50th of 1% of the people who've been vaccinated. So in Tennessee, about one death for every 4,375 fully vaccinated people. If you use the CDC estimate of 14-1, that means the death rate for unvaccinated people may be about 300, one death for every 300, huge differences. So the overwhelming information is yes, there are breakthrough infections, there are breakthrough deaths, but overwhelmingly, the vaccine protects against serious illness and death. So the current surge, we're seeing many increase in cases, not yet an increase in deaths, but a stable death rate that is kind of worrisome and a little different than the pattern we've seen before. Tennessee is not being particularly heavily hit right now, but we expect that it probably will be reasonably soon. And breakthrough infections, of course, they occur. No vaccine is perfect, but this vaccine appears to have very strong evidence that it protects against serious illness and death. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. Thanks, as always, to Dara Young for editing, producing, and posting this video. And I do appreciate getting your questions. I've incorporated several into this week's update. If you have any questions about what I've said today or other issues, please let me know. I look forward to hearing from you. Until next week, please be well.